Every day we face hurdles in our life and problems that require new approaches or breakthrough innovations. In this podcast series, we're going to meet people that take audacious swings for the fence because they believe that changing the game is their personal responsibility. They believe it is up to them to be the solution. Hi, I'm Mark Forchette. I'm the president and CEO of Delphinus, and welcome to our Be the Solution podcast. This is a series where we talk to innovators that have great vision and take audacious swings for the fence. And I couldn't be more ecstatic than to be in this location today as the CEO of Delphinus. This is our very first site in the world for SoftVue. It's Karmanos Cancer Institute in Detroit. And I am here with Dr. Natasha Robinette, whose official title is Radiologist and Clinical Service Chief of Imaging at Karmanos Cancer Institute.
Correct.
Right? Yeah.
Yes, that's correct.
That's the official title, but is it okay if I just say you are very first site in the world and you lead that team, and I couldn't be more ecstatic to have you guys do this. So there's only one person in the world that I can ask this question. It's you. So how does it feel to have the very first SoftVue system in the world to serve your dense breast patients?
I feel very honored and privileged that we were able to bring SoftVue to the clinical bedside, first in Michigan, first in the United States, first in the world. The impact of this new novel imaging modality for women with dense breast, I think, is going to have a huge impact moving forward with the standard of care for imaging women with dense breasts.
Yeah.
So I think it's amazing. I feel great to be a part of this team and to be able to offer this to the women of Detroit, Southeast Michigan.
Yeah, well, so super exciting for us too. And we've been really seeking this day for a long time. So I brought you something today as the very first customer in the world. There's something back here. It's an image of SoftVue. When we shipped the first system to your site, we gathered all the employees together, and every day the employees of Delphinus walk through the door, and they're super passionate about saving lives in this long journey that we've been through. So every one of them signed this poster, and we're going to frame this and put this here in this location as the very first site. And I said rightfully so that this is here at Karmanos because there's a very long history here at Karmanos. And you could maybe tell me from your perspective, kind of your thoughts about SoftVue.
Sure. I had the privilege of working with one of the inventors, the masterminds of SoftVue, Dr. Peter Littrip, here at Karmanos, and also had the privilege of working with Neb Durek, so the two guys who mastermind and came up with the idea of SoftVue. And I've been here for 14 years. I would say 12 years ago, Karmanos provided some of the initial investment and funding with Delphinus for the first prototype of SoftVue. I was here when the first prototype was put in, and we started to image patients and gather clinical data. We were all part of that, both locally, regionally, and then nationally. So it really feels like coming full circle that we're going to be we are the first site to implement this clinically.
Yeah, it's really something else. And so from the commercial side, so I had the good fortune to join this company in 2014. And I actually walked in this exact room. This is the room that the original prototype was in, the Cure prototype. And this is a lot about innovation, having audacious vision for the future. And so Drs. Durek and Littrip kind of scribbled this design on a napkin in about 1999. And then they created a prototype that used, so there's a water bath with SoftVue. They used an aquarium, and they created a really rudimentary ring transducer. They made the original surface of it out of a sailboat sail, and that was all in here.
I did not know that.
It was called the Cure prototype, and that was in here, and it was so compelling that Karmanos here, many of the investors here decided to invest in the effort, and that it ultimately spun out to become Delphinus and get us here to this point. And so, I think about what we sought to do with the unmet clinical needs of dense breast patients, and then what we deliver. And so maybe just now that you have this for your dense breast patients, what do you think are maybe the clinical elements that you're most excited about to be able to put to work here?
Sure. So I think first and foremost, the data, the numbers that say in conjunction with a screening mammogram, 20% increase in detection of breast cancers. So I think that's really powerful in a population where 40% of women have dense breasts. I think on screening mammography, there's always a risk because of how dense breasts appear similar to cancers on screening mammogram that those could be missed. So I think having now SoftVue kind of fill in this void in this area where, there could have been concern on the patient's part or the referring physician or the radiologist part, could we be missing something? I think this is going beyond that and giving more reassurance to our patients, to our referring physicians that we've given it a second look and we're not seeing anything bad, or in fact, we did find something and we're detecting it early. Mm-hmm. And early detection, as you know, with cancer, means faster treatment, better outcomes, increased chance of survival.
Yeah, so what you're talking about there, so SoftVue is about kind of a breakthrough performance. We showed we improved sensitivity and specificity. You kind of can't do that with just doing things the same way. So it's a radically different system. So the whole water bath, the ring transducer, those are all the things that were really the technical challenge. And I think the other technical challenge that came into play here was it gathers so much data to characterize tissue that if you go back to the early days when it was a sail cover, it would have taken like a Cray supercomputer to process all that data. But that's all this team sort of wrestled the laws of physics to the ground and figured that out. And now they ultimately have delivered something that delivers to the promise of what we hoped. So I think one of the things with patients we thought a lot about was the no compression, no radiation, the water bath.
Sure.
The patients still have a mammogram, and the mammogram determines the density, and then the patient moves to SoftVue based on that. But it's no additional compression radiation.
Correct.
So how do you think that resonates with patients? What do you feel about that? Do you think that is really key to them with their additional screen?
I think being comfortable is key for our patients. I think some of the modalities that we have with breast imaging that provide radiation is always a concern to our patients. Yeah. And cumulative dose throughout the patient's lifetime is a concern. And I think the comfort factor, some of the other modalities we have compression, whether that's screening mammogram, whether that's an automated breast ultrasound system, that is not a very comfortable system. Comfortable systems for our patients. Yeah. So I think all of these things, the lack of radiation, comfortability, the fact that 95% of the women that have had this exam would recommend it to a friend or a family member, I think that all really matters. These are the things that patients and women are going to talk about verbally. They're going to tweet out to their friends. They're going to text.
Yeah. So now you have a SoftVue system here. It's right here, it's ready to be integrated, and so that results in a couple of things to integrate that you have to think about. So how do you put it into kind of your patient screening algorithm? And then also the staff that you have do this. This is a new element to it. So could you comment maybe on some of those things, the kind of integrating into your algorithm of screening, and then same day as the indication, how does that work for you and the people that actually do the scans?
Sure. So I think first and foremost here at Karmanos, we made the decision that we wanted our trained ultrasound techs who currently work with our breast patients to actually run and work with the machine and the patients. They already have that training of working with women and the sensitivity around breast imaging. So that was our decision here at Karmanos to do. As far as workflow, it's a work in progress still. We are currently using SoftVue same day with many of our clinic patients, whether it's high-risk clinic or breast cancer clinic patients. And so we're trying to work out that workflow now, but that is same day and same day results. But right now, with it just being new, we are having a lot of patients coming in that they would qualify for the SoftVue, but don't have an order yet from their referring patient. So trying to work, or from their referring provider. So trying to work through how to get those women serviced same day. Still a work in progress. My vision would be that within a few months from now, or even looking forward to a year from now, women who are walking in the door today that we know have dense breasts, and we're reaching out to their referring providers, when they come in the following year for their annual, they're going to come in, and we already know that they have dense breasts, they're going to come in for their screening mammogram and for their SoftVue study. So this is where it's going to change standard of care, how we're taking care of our patients with dense breasts. I think right now we're in a little bit of finding out where the sweet spot is and how to make that happen currently for our patients walking in the door right now that maybe don't have those scripts, or their referring providers haven't heard about it or don't know about it yet. So that's where we're at right now. So we are doing same day with our clinic patients for sure, because those providers are in-house. They know about this. They know it's here. They know it's available for their patients. But for our outside referring providers, getting the word out, making sure that they know, so that as quick as possible we can implement it same day for their patients.
Yeah, awesome. So one of the things, SoftVue is obviously, it's super different. It's unlike anything else. And you have kind of a blue ocean technology. It creates images that look different, and you might look at them and think of the coronal plane stacks that SoftVue offers, and there's 4 sequences that get imaged. So it's natural to look at that and go, wow, how high is the hurdle to actually get comfortable reading? I'm curious, as your team has gone through the training, any thoughts, comments on the ability to read SoftVue, and how comfortable, how quickly, what you sense from that?
So I think with everything, there's a learning curve. I think the breast radiologists who've gone through the training here, I think they're feeling really good about it. I think they're feeling good about it to the fact that the same day patients that are being seen here in our clinics that I just talked to you about, they're starting to hesitate to give a read to our providers without having that SoftVue data. So I think there's a lot said there.
It's really interesting to me as we did training of people that participated in our trial and reader studies. This kind of blue ocean reading new images was something that we heard as a initial concern or people worried about. But I think most found it disarmingly straightforward and kind of, I think disarming is the right word. Was not at all what people felt they were going to see. It was really readily learned and adapted to, and I found that really fascinating. I think it goes to all the work that was done by some of the clinical team members as they developed the protocols. So since you have had this system, I think that you've done things like this almost every day. There's been a lot of media interest and a lot of people that have been very curious about this. And so I'm thinking about one thing that is particularly interesting to me is I think there's that interest because of the dense breast screening challenge and what patients experience when they get their breast density notification letter. And I've talked with patients where they're anxious or they're confused, they're uncertain, like, what do I do with this?
Right.
And I guess I just want to, is that is that a real issue? And do you
I think it's
how's
very
this
common.
satisfying?
I think it's very common. I think most women, when they get that letter, either they don't know what to do with it, they don't know what that means, or there's anxiety over, oh, they're telling me something in addition. What do I need to do with that? What's my next step? So I think this provides that answer. This provides that additional assurance of, hey, we have this other screening modality that in conjunction with the mammogram is going to have increased detection of breast cancers. Here at Karmanos, the letter, I think it's 31 states that are required to send out letters to patients about their screening mammogram results and density of breast tissue. Michigan is one of those states. And the letter we send out here at Karmanos says, you have been identified, you have dense breasts. This is a normal finding. However, you could be at increased risk of breast cancer or increased risk of a cancer not being detected. To please reach out to your physician and have an informed discussion with them about what's next for you. For many women who may have other increased risk factors like genetics, BCRA1 and 2, a first-degree family member who had breast cancer, themselves with ovarian cancer, any of these risk factors that their physician can now add to their armament of additional things that they can do to their patients, SoftVue. So I think that's great. But I do think this, for most women, they're not sure to where to go with it. So we recommend having a discussion and talking to your doctor about possibly MR breast, whole breast ultrasound. Now for us, that letter will be changed to add SoftVue to it.
Yeah. Well, and that's, as we thought through the whole unmet clinical need here, we really thought about the anxiety and the imperfect solution that technology presents out there now prior to SoftVue. That's what we sought to address, and we tried to really address everything with our indication, same day screening, and having you could use a medical assistant. There's no specific degree or license required. So all those things are aimed at trying to implement this in a way that all dense breast patients could have access to it. So I'm super excited for you guys, and I should say that you have. Now you went through the installation process, the training process, getting everything certified to be ready to go. And last Thursday, you screened your first 3, and it was super exciting for us, and I hope I'm sure for your team.
For my team, yeah.
And any thoughts on that? Just
no, I think we discussed it earlier that the feedback with the breast radiologists that for our same day clinic patients, they really want that SoftVue before they're giving a full picture. I just talked with one of our breast radiologists, Dr. Camilla Skulski, and she had a case that she was hesitant to give results to the provider in the breast clinic, and she waited, and the patient had to wait, unfortunately, a little bit for those results to come back. But it did change based on the SoftVue. They actually made her a category 0, and she needs additional imaging. So that's within the first 4 days of us using this new modality. So there's definitely power there. I think the breast radiologists are already seeing that.
So my mom had breast cancer. That's why I joined this company. Those employees are driven by the passion to create this new solution, and now to have it here is incredible. I think about this room being the place the prototype was in, and now this system is here, and now the first patient in the world in its commercial use was screened here. That entire process stands on the shoulders of hundreds of scientists and physicians, thousands of patients. And, we say as a company, and this podcast is about taking audacious swings for the fence and being the solution to unmet needs. And that's what's happened right here in this room. So congratulations to
This
you and your team.
room has been dedicated to SoftVue for 12 years.
Wow. Wow. Awesome. Thank you for watching, and I'm sure we'll communicate more about this site and what happens going forward, but it's already on a fantastic path to be the solution for dense breast screening. Thanks for joining us.